Hello and welcome. Today, we're diving into the revolutionary role of artificial intelligence in pathology, a field that really is the final word for so many medical diagnoses.
So, here's what we've got on tap. We're going to start with pathology's big digital leap, which is the foundation for everything else. Then we'll look at how AI is acting as a second opinion, especially in cancer diagnosis. After that, we'll peek into the future with a new field called Pathomics, but then we'll get our feet back on the ground with some real-world challenges. And finally, we'll set things up for our next topic.
All right, so to really get a handle on AI and pathology, it helps to think back to what we discussed in radiology. Radiology, is often about the big picture. We're looking at organs and entire anatomical structures. Well, today, we're zooming way in. We're shifting our focus from that micro level down to the microscopic world of individual cells and tissues.
And this incredible shift in scale is exactly why pathology is often called the ground truth for so many diseases. It's where a diagnosis gets confirmed, right down at the cellular level. And this entire field is, right now, going through a massive technological revolution.
For over a century, the microscope was it. That was the tool. But relying on physical glass slides created some huge challenges. Think about rising workloads, the difficulty of getting a second opinion from an expert across the country, and just the natural variability between diagnoses. But today, by digitizing these slides into these enormous gigapixel files, we call them whole slide images, we've basically liberated that data. It's no longer trapped on a piece of glass.
And this digital transformation is absolutely crucial, because once that data is digital, it becomes computable. And that sets the stage for AI to step in, not as a replacement, but as this incredibly valuable partner for the pathologists.
So, if you remember one thing, let it be this: AI is not taking over. It's much better to think of it as a tireless expert assistant that never gets tired, right? It helps standardize results, it can catch really subtle findings, and it helps reduce that enormous burden on a limited number of specialized pathologists who are facing more and more cases every year.
And this isn't just some theory or a cool idea. Major studies published in top-tier journals like The Lancet Oncology are showing that AI can detect and grade cancer at a level that is comparable to world-renowned experts. That's a huge deal.
This number right here, this really just illustrates the power of these tools perfectly. For anyone who's not familiar, the area under the curve, or AUC, is basically a scorecard for diagnostic accuracy. A perfect score is 1.0. So hitting an AUC of 0.997, that means near-perfect accuracy in telling cancerous tissue apart from benign tissue in prostate biopsies. It's just a stunning level of performance that translates directly into more reliable diagnoses for patients.
So with that kind of accuracy, let's take a look at how this all builds into specific, real-world applications across oncology.
You can see here, AI is being used for all sorts of tasks that are incredibly labor-intensive and, honestly, can have some variability between experts. Things like Gleason scoring in prostate cancer, which is critical for figuring out how aggressive a tumor is, or painstakingly counting mitotic cells, those are cells in the middle of dividing, to grade breast cancer. These are just perfect jobs for an AI assistant. And it's not just the common cancers. We're seeing similar tools developed to analyze bone biopsies for everything from bone tumors to metabolic bone disorders. So what does all this mean for the day-to-day workflow in the lab? Well, the impact is profound. We've seen studies showing that labs using these tools can cut their diagnosis times by nearly 28%. That means faster results for patients who are waiting and worrying, and it frees up pathologists to focus their incredible expertise on the most complex and challenging cases.
In practice, this can be a lifesaver. Picture this: a busy pathologist is looking at dozens and dozens of cases in a day. And AI can act like a safety net, flagging a tiny little cluster of cancer cells in a lymph node that might otherwise have been missed. That single alert can literally change a patient's staging and their entire treatment plan.
Okay, now this is where things get really futuristic. We're moving beyond just having AI do what a pathologist can already see. Now, AI is starting to unlock a completely new layer of information, data that's basically invisible to the human eye, hidden right there in a standard tissue slide.
This new and really exciting field is called Pathomics. It's all about pulling out thousands of these subvisual features from an image and analyzing them with a computer. And this is a true cornerstone for the future of precision medicine.
Here's a fantastic way to think about it. If genomics gives us the inside view of a cell, its genetic blueprint, its mutations, then pathomics gives us the outside view. It's like the architectural plan for the entire tumor ecosystem, showing us how all the different cells are organized, how they're shaped, and how they're interacting with one another.
The potential here is just incredible. We're seeing landmark studies, some in journals like Nature Medicine, that have shown AI can actually predict a tumor's genetic mutations just from looking at a routine pathology slide. For instance, it can predict MSI status, that's microsatellite instability, a huge biomarker for immunotherapy and colorectal cancer. This could totally streamline the diagnostic process, maybe even bypassing slower, more expensive genetic tests and getting patients on the right treatment 10 to 14 days faster.
Of course, as amazing as all this technology sounds, it's not a magic wand. And if we're going to deploy this responsibly and safely, we have to look at some limitations right in the eye.
And these are all critical issues. You have technical hurdles, like making sure a model that was trained at one hospital works just as well in another hospital that uses different scanners or staining techniques. You have huge validation challenges, like addressing algorithmic bias to make sure these tools work for all patients. And then you have practical things, like the black box problem. We need to understand why an AI made a certain prediction. The entire field is working hard to solve these challenges.
And this all brings us right back to that clinical pearl from the beginning. The path forward isn't about automation, it's about augmentation. It's a team approach, a collaborative model, where the pathologist is still in charge. They provide that essential oversight, the clinical context, and the final diagnostic judgment. But now they're using AI as a powerful and validated new tool in their toolkit.
So up to this point, we've been exploring how AI analyzes disease at the microscopic level, looking at tissue that's been taken out of the body and put on a glass slide. But what happens when the diagnostic clues aren't hidden away on a slide under a microscope? What if they're visible right there on the body's largest organ, the skin?
And that's the perfect setup for our next chapter, artificial intelligence in dermatology. It's truly one of the most promising areas for AI in all of medicine, simply because so much of it relies on visual pattern recognition, and that's something deep learning is just fantastic at. Join us next time as we explore how AI is learning to see what's on the skin.